Let's also talk about the NHS, because, my God, I'm not sure I'm not sure it was an honest statement from Jeremy Hunt yesterday when he announced an extra 6, so always extra money for the NHS. He said that the health service is, rightly, the biggest reason most of us are proud to be British. Is that rightly the biggest reason why you are proud to be British, Chris?
No, but there is a survey that backs up what Mr. Hunt was saying there. It does indeed, the NHS, come ahead of everything else, our history, our monarchy, anything else you can think of. It's kind of embarrassing, but that's how parochial so many people are in Britain. They don't really know that on the continent. They kind of laugh at the NHS. They think that the way we worship it is a weird British eccentric quirk, which it is. They don't realize that you can get healthcare for a lower price, much better, without having a US system, which is the only one that people ever talk about by comparison, because it's the only one in many ways that's worse. So yeah, I mean, I'm ashamed. The thing that makes me most ashamed to be British is the fact that so many people think that the NHS is the best thing about Britain.
That's a very, very good point. And, there was a time when I think we rightly should have been proud. I mean, it's been, in place, 70 plus years when, we were the first country to do this. And the idea that people should get the healthcare they needed at the point of need for free rather than based on ability to pay is a wonderful, wonderful thing. But it is interesting that pretty much no other country in the world copied our system. But as you say, virtually every other Western country does have a system where people can get healthcare. A lot of people are still under the illusion, two things. One, poor people don't get health treatment anywhere in the world. They just think it's just America. Again, they've got a completely messed up system that costs 3 times as much and is terrible for outcomes. And they're also under the illusion that we have a good healthcare system, like we actually have good outcomes. And I tell you what, I've done enough question timers over the years when I've said things like, which are factually true, based on, even like, King's Fund would back this up, say, the NHS is a great institution. It's great at doing everything apart from keeping people alive. We still have, some of the lowest for a wealthy country. I don't think we should be comparing ourselves to Cambodia, and Venezuela. We have some of the worst outcomes for heart disease, for cancer care survival and things like that in the world. And yet people are still under the illusion it's a good system. But if they think there is a problem, they think the problem is underfunding. Is that true?
No, it's one of the most heavily funded healthcare systems anywhere in the world, and it's had a lot more money over the last 10, 15 years, despite people talking about austerity, and particularly in the last 4 or 5 years. Staff numbers have been going up by about 35% in the last 10 years. It's not understaffed by any reasonable metric, and it's not underfunded by any reasonable metric, unless you think it should just be getting double the money and double the staff every 10 years, which is obviously unsustainable. Look, it's just a bad system. It's badly managed. It's far too big. There's no competition. There's no price mechanism, and so you get a system that ultimately works for the benefit of the people who work within it. But not even all of those, because a lot of doctors and nurses hate the way the NHS is run too. It works for the managers primarily, but it certainly doesn't work for patients.
No, indeed. Well, I mean, it's interesting, actually. You tweeted out last night some new ONS data, also National Statistics data, on the, as you say, supposedly understaffed NHS. And I have to say, we're going to put it up. It's on the screen right now, but for those listening, it's absolutely astonishing. In England, since 2013, the number of employees in the NHS has gone up by 35%, so more than a third. The number of doctors, we always talk about a shortage of doctors, it's gone up. Now, and by the way, that's full-time equivalent. So we know we've got more doctors, but a lot of them working part-time. Full-time equivalent is up by 37%. The number of nurses, midwives, health visitors has gone up by 23%. The number of support staff to clinical staff up by 45%. And the number of NHS infrastructure and support, I don't know what that means, 41%, that's gone up. Now, those are huge increases. At the same time, Christopher Snowdon, our population has also gone up, but I think by about 7%, so nothing like that. We've also got more elderly people, and they require more healthcare, a bigger use of resources. But how do we account for this massive increase in the number of people working in the NHS, including in clinical roles, although there's been a lot more people in non-clinical roles, with the outcomes we're getting right now, the inability of people to get treated, to get an operation, to see a consultant, to start treatment?
Well, since I tweeted that out, I've had numerous people in the replies making all sorts of excuses, mentioning the population growth, which, as you say, is quite small compared to the increase in staff numbers and funding, but also the fact, yeah, aging population, more obese people, and so on. But the question then is, okay, well, at what point is it not underfunded? If increasing the staff by 35%, increasing the funding in real terms by 40% in the course of 10 years isn't enough, how much would have been enough? And how much do we have to keep pouring money into this thing until it's no longer underfunded? And why is it other countries don't need to put in quite so much? These are the questions. But you get this blind worship of the NHS, and it doesn't matter how much money goes in, it's never enough. It doesn't matter how many staff that working there, it's never enough. Nobody can entertain the thought that maybe some of these staff are not needed or are doing a poor job or are facing perverse incentives that makes them very inefficient. And
A
yeah,
big question for a lot of people also just about the management. As we see, some hospitals do very well, other hospitals don't. Well, that's got to be down to a management issue, not anything else. Really good to talk to you. Thank you very much indeed for joining us, Head of Lifestyle Economics at the Institute of Economic Affairs. That's Chris Snowdon.